So the first thing you'll need to do is get a referral explaining your problem from either a specialist or a GP. And the best way to get that to us is via email at referral@sydneyskinandvein.com.au. Once we've received your referral, this will be triaged by Professor Parsi.
As Professor Parsi is a specialised phlebologist, vascular dermatologist and vascular anomalies specialist, not all referrals will be suitable. We also triage referrals based on urgency and may redirect you to more appropriate providers if your referral is related to a general dermatology condition or a cosmetic concern.
We may also ask you to send photos just in order to further aid with the triage process. No, you don't need to call the clinic. You will be guided through the multi-step referral process by our referrals manager, which includes reading over and completing our centre policy agreement and also collecting a holding deposit. The deposit is a holding deposit that stays in your electronic health file. It's to deter from late cancellations and no-shows and to ensure the smooth running of the clinic, and it is fully refundable at the point of discharge.
Professor Parsi treats a wide range of vascular anomalies. As a vascular anomalies specialist, he also treats venous disease as a phlebologist, and his dermatological interest is vascular dermatology. So he generally doesn't see general dermatology patients or cosmetic patients. Professor Parsi sees both children and adult patients, and this is on the background of previously being a staff specialist in dermatology at the Sydney Children's Hospital in Randwick.
On average, we usually book 3 to 4 weeks after we've received a referral. However, accommodations can be made in urgent cases. On your initial visit, you will be asked to complete a patient questionnaire. So we usually advise that you give yourself 15 minutes before your appointment time to complete this.
In addition, many of the patients that we see at this clinic are quite complex, which requires longer consultation times. And because of these thorough consults, sometimes there may be a waiting time depending on the day.
No, you won't need to source any ultrasounds before your appointments. We have specialised vascular sonographers on site who can take care of any ultrasounds.
In addition, during your first consultation, we can assess whether an ultrasound is required and which type to make sure that you have the most personalised investigations. When we see you for your initial appointment, you'll have a thorough history and examination. Following that, we will make sure that any investigations required are done, including ultrasound. At your next appointment, we may discuss treatment options, or this may even require a third appointment depending on the clinical complexity of your condition. Following that, we will be directing you to our bookings team.
And rest assured, you will go through a comprehensive booking process with our admissions coordinator.